It's so funny how my patient said I was carrying this box like a box of pizza.
Hi, welcome to our YouTube channel. This life is Frenchies.
Okay.
Or non-reactive.
Okay.
Reassuring or non-reactive.
Okay. What if it's not meeting? What would I do?
Say one parameter is like, let's say we are having several decelerations, more than 2, you can say it is non-reassuring or it is reactive.
Okay.
That's how you label it. So
this is welcome you to. This is an institution that we have collectively built to what it is now. Like I said, collectively, not the effort of the management alone, effort of the staff and the management and the patients, and we have been able to achieve this. We have a history, and that's why we are organizing this kind of program, so that the positive changes that will impact this health institution, and not just here alone, nationwide, because our impact has been felt nationwide. Thank you. Thank you very much, sir, for that practice as a medical doctor of the internal. So, we go through the 4 major departments in medicine, and after that we will report the plan. And if you satisfactorily conclude your housemanship, I don't know if you know that at the end of your one, at the end of each posting, you'll be assessed. Have you seen the assessment form? You see it? Who has seen it?
Feels like I'm getting warmer when I'm getting real close to you. I feel like something's missing with this hole stuck deep inside. To add some color to my canvas, take me to another level. You better be ready, yeah. Tell me what are my chances to find you tonight? I'm looking fun and you're looking just fine. Just right to you is just so damn bright. I'm stopping when the planets collide. Those levels is so much that I cannot find.
So I'm in clinic. It's quite a noisy place, but yeah. I came for this. It's basically to check the packed cell volume for our patients. This is antenatal, so yeah. That's basically what is happening. Hopefully I can settle down and talk to you guys properly later. But it kind of gets busy and I don't think I'll be able to vlog. It's so funny how my patient said I was carrying this box like a box of pizza. But yeah, highlights of my day. Bye people. Well done. Okay, so here you're going to write everything small so it will enter. Okay, so write your name. Wait first. Write your name. Okay. Yes, on top of this line. So write your name, then you sign right next to your name. Well done, my big name. You sign right next to your name. Then you write today's date. Let me check for you.
Yeah. Let me just. How has it been going? It's been a full day, and basically we had morning review. I didn't even bother vlogging any of that because these days I'm trying to be as intentional about morning reviews as possible. So that means that I'm learning a lot of postgraduate stuff, like stuff that's higher than my level, being intentional, taking notes, and all of those good stuff. Now, because there's a lot of details, like intimate details, because there's a lot of specifics about patient management and things like that, I don't like to share those sessions. But yeah, basically what happens in those sessions, we discuss patients. So we had like 20 patients on the ward, for example, or 20 new cases on the ward, for example. We discuss them with this patient, for example, Mrs. EP, which maybe would stand for eniipaul, and so she came in on account of so maybe a 38 weeks gestation or something to share, describe the patient. So if they came in due to pregnancy, maybe they were in labor, they had labor pains that they're at home, how we're managing them, how the labor is progressing, all of those things are things we would speak about. Or is she dilating properly? When was the last time she was measured? What are our plans? In the event that she doesn't dilate fully, what is the way moving forward, and all of those kind of things. So yeah, that has happened. How did we end up going? So after morning review, we had antenatal clinic, and it was a clinic where I was sharing with you guys that I went to take those the sickle measuring thing. Can't remember the name right now, but basically we use it to check for your hemoglobin and your packed cell volume levels. So we use it in sickle cell patients most especially, because there are people that are at higher risk for anemia, at higher risk of anemia in pregnancy. Now everyone will experience anemia in pregnancy because as a woman you already lose a certain amount of blood each month. But then when you're pregnant, pregnancy takes up all of your iron stores, like all of your iron reserves. So if you're not refueling that iron, like if you're not having any iron supplements, folic acid and things like that, you're going to go anemic and pale. After that, after clinic, we ended up having doing some bedside ultrasound scans, and I was able to do one myself, do some mop-ups and things like that. We had some really delicate patients. One of them had a miscarriage, and is sad when you see a patient lose a baby or lose a loved one. Is sad, but well, at this point we have to take stock of what we have left and take care of the mom. So that's what we're doing. I was so fatigued, so fatigued. It is wild that I have not had anything the whole of today. I love you guys. You guys take care of yourselves. If you're watching up until this point, you're a doctor, please do not be like me. Do not have to handle fatigue like me. Find the mechanism that works for you. Bye, people. How was your call?
My call.
You go do my video. You go do my YouTube video.
Hi, welcome to our YouTube channel. This life is French cheese. I slept for 2 hours and one patient came around 4. Another patient doesn't have shame back.
Okay, so let me talk to you guys properly about what has happened and what is currently going on. We have a patient that we worked up for a surgery. So I'm going to go into theater now and I'm running out of battery, so I'm just going to charge and I'm not going to be able to take you guys along with me. But yeah.
Fibrinosin inside, and this eniipaul layer is respond when it is absent. There is going to be the placenta will morbidly attach into the endometrial wall. Also, the placenta, the maternal antibody, which is the immunoglobulin G, pass through the placenta to the baby. So the anomalies of the placenta, the anomalies of the placenta can be result as a result of implantation anomaly